in the yoga group in all the three glycemic parameters. In control group, there is change, but it is not significant. But for people who have undergone both yoga and as well as taken the standard medical management, they have shown a statistical significant improvement. This shows yoga helps to increase the efficacy of the drug and decrease the side effects of the syndromes. By this randomized pilot study, we provide evidence that yoga as an adjuvant therapy with standard medical can improve the glycemic profile in metabolic syndrome patients, and it can be adopted along with the standard medical management. And yoga as a therapy is very cost effective, simple, and it has very minimal risk, and it can be easily advocated as an adjuvant or complementary therapy for an integral system of medicine for health and well-being of all diabetic patients and the patients who are suffering from the metabolic syndrome. Thank you for the opportunity.
Coming to the next participant, Mrs. Kumari Khushbu Singh from the College of Physiotherapy, Dayanand Sagar University. She'll be talking about the assessment of multidirectional gait hypokinesia in Parkinson's disease, preliminary to the development of biomechanically evaluated gait stabilizing yoga practice.
Hello everyone, I'm Kumari Khushbu Singh. I work as an assistant professor in College of Physiotherapy at Dayanand Sagar University. My topic for poster presentation is assessment of multidirectional gait hypokinesia in Parkinson's disease, preliminary to the development of biomechanically evaluated gait stabilizing yoga practice. Gait hypokinesia is one of the disabling features in Parkinson's disease. This limits their walking in different directions during activities of daily living and adversely affects their quality of life. Yoga is known to favorably influence the irreversible factors disturbing the gait and motor functions, besides contributing to the confident motor performance in PD patients. Evaluation of the multidirectional gait velocity in Parkinson's disease patients would be of value in designing customized yoga therapy programs. The aim of the study was to analyze and compare the gait velocity in forward, backward, and sideways directions, both right and left in freezers and non-freezers, for which 30 subjects were included in the study by purposive sampling and were divided into two groups with sample size of 15 each. Group A consisted of freezers and Group B consisted of non-freezers. All the subjects performed 10-meter walk test in their off state of medication in all four directions. Their 3 readings were taken and their average was included in the analysis. Within group comparison and between group comparisons were performed. In the results, the baseline data showed no significant difference except for freezing of gait questionnaire. Within group A, subjects could walk faster in forward than backward and sideways to either side, showing a statistical difference, but there was no statistical difference when backward was compared to sideways to either side or when sideways right and left were compared. In group B, subjects could walk at a faster speed in forward with a statistical difference when compared to backward and sideways to either side. There was no statistical difference when backward was compared to sideways to either side and also when sideways was compared to either side. In between groups, when forward was compared between the groups, we didn't find any significant difference in their speeds. When backward was compared, there was a statistical difference, showing freezers took more time than non-freezers. There was a statistical difference in speed when sideways right and sideways left was compared between the groups. In conclusion, backward and sideways to either directions are affected more as compared to forward in both freezers and non-freezers. Practice of standing yoga poses targeting the hip and knee extensors and ankle plantar flexors help maintain the center of mass at a favorable level during gait and help patients re-establish their near normal gait pattern. As the progression of this pilot study, the biomechanical components of yoga postures suitable to train the muscle groups responsible for functional mobility in Parkinson's disease patients is being evaluated. Following are the references for the poster presented.
So our next participant is Dr. Preeti Upadhyay from Beth Israel Deaconess Medical Center. She'll be talking about inner engineering online intervention reduces perceived stress in compliant participants, a waitlisted randomized control trial.
Greetings, everyone. My name is Dr. Preeti Upadhyay, and I am a research fellow at the Department of Anesthesia, Critical Care, and Pain Medicine in Beth Israel Deaconess Medical Center, Massachusetts, USA. I will now be presenting an e-poster on Inner Engineering Online Intervention Reduces Perceived Stress in Compliant Participants, a waitlisted randomized controlled trial. It is a common understanding that chronic workplace stress causes burnout. Inner Engineering Online is a web based intervention which is known to improve physical, mental, and emotional health of an individual. We hypothesize that routine practice of IEO will lower stress levels and prevent burnout in the participants. In order to prove the hypothesis, we conducted a prospective randomized control wait-listed trial on 71 eligible participants who were randomized into two study groups. The active group received intervention, that is Inner Engineering Online, and the passive group received reading intervention in the first 4 weeks of the study, following which the control arm was crossed over to receive the IEO intervention. The outcome measures defined were burnout, which was defined as the primary outcome, perceived stress, which was defined as the key secondary outcome, and other outcomes such as depression, anxiety, mindfulness, attention awareness, and dispositional positive emotion scale, joy subscale. Data was collected using REDCap, and de-identified data was analyzed using SAS, with two-sided p-values of less than 0.05 considered as statistically significant. Only the key secondary outcome, that is, perceived stress scores, demonstrated evidence of decline in intergroup comparison along with a decline in scores from baseline. The perceived stress score, when compared in compliant individuals, demonstrated a significant decrease with intervention. REST scores, including the primary outcomes, did not show any significant difference in intergroup comparison. However, there was a perceivable decline in the scores of negative affect, that is, anxiety, depression, exhaustion, and cynicism in the study participants. To conclude, the most likely explanation changes in burnout scores could be healthy workers effect. That is, study sample predominantly included healthy workers. Further, perceived stress scores and measures of negative affect demonstrated a significant decline in compliant participants exposed to the Inner Engineering Online intervention, suggesting the likelihood of disproportionate impact of IEO intervention on measures of negative affect in comparison to the positive affect. However, further exploration with a larger sample size is warranted to examine this theory.
Now we'll move ahead for the next presentation. The speaker is the same, Dr. Preeti Upadhyay, and she'll be talking about a study on the prevalence, protection, and recovery from COVID-19 in seasoned yoga practitioners in comparison to age and gender matched controls.
Greetings, everyone. I am Dr. Preeti Upadhyay. I work as a research fellow at the Center for Consciousness, Cognition, and Compassion in Beth Israel Deaconess Medical Center, Boston, Massachusetts. I will now be presenting an e-poster named Routine Isha Yoga Practice Enhanced Well-Being and Reduced Stress compared to age and gender matched controls during COVID-19 pandemic in United States. COVID-19 pandemic is a global stressor, and world population is applying various practices to combat it. One such measure is Isha Yoga, which is popular due to its simplicity and ease of access. We hypothesize that routine practice of Isha Yoga will reduce stress and enhance well-being in the current stressful stage of COVID-19 pandemic. This was achieved by comparing an observational arm of seasoned practitioners to age, gender, and region-matched novices. The novices or the control group were further randomized into active controls who were introduced to Simha Kriya and placebo controls who performed no activity for a total duration of 12 weeks. The study outcomes were defined as perceived stress as the primary outcome, resilience as the key secondary outcome, and other measures included anxiety, depression, joy, mindfulness awareness, well being, and post traumatic inventory. Only baseline data has been collected and analyzed. Of the 17,618 collected responses, 5,001 completed responses correspond to seasoned yoga practitioners, while 2,569 corresponded to control. The baseline demographics, including age, gender, education, and employment status, were comparable in both groups as demonstrated in Table 1. Intergroup comparison between seasoned yoga practitioner and controls at baseline demonstrated a strong evidence of statistically significant lower scores for negative affect measures such as perceived stress, anxiety, depression, with higher scores for measures of positive affect such as resilience, well-being, joy, and mindfulness awareness in seasoned yoga practitioner group. Adjusting the data for confounding effects of age, gender, education, and employment did not alter the results. These results are illustrated in Table 2. Baseline analysis suggests that routine Isha Yoga practice enhanced well-being and reduced stress in study participants during COVID-19 pandemic in United States of America. The results also demonstrated an equivocal effect of Isha Yoga on measures of both negative and positive affect in routine practitioners. Data collection is now complete and further analysis is underway.
To the team of YANTRA for organizing such a wonderful conference on the theme of yoga.
So now we'll hear the presentation by Dr. Ruchika Tuteja on the evaluation of psychological behavior in children undergoing surgery for CHT. I would request the attendees and the panelists to give me a couple of minutes. There is some issue with this presentation order. So if you can please bear with us for like 2 minutes or so. Thank you very much. I believe that the problem is fixed now, so we'll just move ahead with the presentation. Thank you.
To the team of YANTRA for organizing such a wonderful conference on the theme of yoga that gives us an opportunity to present our study, a subset of which is evaluation of psychological behavior in children that underwent surgery for congenital heart disease at our AIMS Institute in the Department of CTVS, and which were modulated by Rajyog meditation. I am Ruchika Tuteja, physiotherapist at the Department of CTVS since 2005 at AIMS, New Delhi. Success of pediatric cardiac surgery does not depend only on the surgeon, but on the whole team, which includes not merely the therapist, the psychologist, the parent, and the kid himself. Rajyog meditation gave us an opportunity to treat patients on a holistic basis, wherein they were not only operated as just beings physical body, but as psychological creatures, emotional beings on a spiritual front, handled in a beautiful way via Raj Yoga, both pre-operatively and post-operatively, so that their anxiety levels, which contribute to the maximum level of success or failure, were handled. The aim of this study was to evaluate the efficacy of Rajयोग meditation in a scientific way on the psychological behavior of the children that were operated for CHD. We randomized the groups into two, that was control group and the intervention group. The intervention group was the one that received Rajयोग meditation on the protocol basis, and then we finally recorded the behavioral changes on the post hospitalization behavioral questionnaire. The present study were really motivating. We analyzed utilizing the Stata software, in which the patients we found that who underwent the Rajयोग meditation training had higher PHBQ scores in comparison to the control group, which simply signifies that the anxiety level of the patients undergoing Rajयोग meditation were much less than the control group. Positive results of the study demonstrated the clear-cut role of Rajयोग meditation in improving the psychological behavior in children and adolescents undergoing surgery for CHD. Children and adolescents are the most difficult patients to handle, and the fact that this study portrays that even children and adolescents are receptive for learning and practicing meditation is really hopeful. The pediatric cardiac care is infancy in India, and a study on CHD patients comprising of cardiac rehab and inclusion of spiritual Rajयोग meditation at the apex institute of our country is a landmark study. Thank you very much.
Our next participant is Ramana Vishnu Botla. She'll be from Indiana University School of Medicine. She'll be talking about Isha Yoga Samyama meditation enhances brain executive control network functional connectivity.
I'd like to present our project titled Isha Yoga Samyama Meditation Enhances Brain Executive Control Network Functional Connectivity. This study involves the Samyama program, an 8-day advanced meditation program which requires many prerequisites and 2 months of intense preparation. We recruited 21 study participants, including 15 meditators and 6 controls. Neuroimaging scans were done using functional MRI to assess brain function. Participants underwent fMRI with meditation-focused breathing and at the resting state. Group differences within network connectivity were assessed using independent component analysis in meditators and controls before and after the Samyama program. We hypothesized that there would be improvements in brain functional connectivity in executive control networks following the Samyama program. For our results, we had some interesting observations. Here we are showing 2 brain scan images. We were able to notice signal in the anterior cingulate gyrus, which can be seen in green. This is an important part of the executive control network. The first set of scans shows significant differences in meditators before and after the Samyama program. The second set of scans shows significant differences in meditators after the Samyama program compared to controls. We did not see significant difference in functional network connectivity in meditators versus controls before Samyama or controls before and after the Samyama program. There were no significant differences in breath watching fMRI versus quiet breathing resting state fMRI in Samyama participants at both time points. There were no significant differences in other resting state networks. On the left, we see 2 charts representing the data mentioned in the previous slide. We can see from panel A, there were significant increases after Samyama in meditators, which was not seen in controls. The data in panel B shows that there were similar increases in both resting and breathing states in meditators after Samyama. To conclude our presentation, meditators showed greater connectivity in the executive control network after the Samyama program compared to before. These changes were seen in meditators, but not controls. This correlates to improvement in attention, memory, impulse control, emotional stability, self-awareness, and problem solving. Future long-term studies are needed to further understand the impact of a sustained meditative practice on brain function. We thank you for joining us today for this presentation.
Is the same person, Ramana Vishnu Bhotla. He'll be talking about Isha Yoga practices and Samyama retreat are associated with reduced HbA1c and systemic inflammation, improved lipid profile, and sustained improvement in mental health.
Today, we would like to discuss a research project titled Isha Yoga Practices and Samyama Retreat are associated with reduced HbA1c and systemic inflammation, improved lipid profile, and sustained improvement in mental health. This study involves the Samyama program, an 8-day advanced meditation program which requires many prerequisites and 2 months of intense preparation. We used surveys and gathered blood data to assess the impact of Samyama on participants. Subjects were recruited for at least 60 days prior to the program and were excluded for certain criteria, such as drug use. There were 4 time points, 2 before and 2 after the program. Surveys included 10 scales to assess common criteria, such as anxiety and depression. Blood samples assessed common biomarkers such as hemoglobin and lipid profiles. We hypothesized that both physical and mental parameters improve after the Samyama. Now on to the results. In panels A and B, participants suffering from depression and anxiety were able to fall below the threshold values after preparation and participation in the Samyama program. They sustained levels below the threshold values months after completion. Participants experienced the lowest depression and anxiety at time point 3. Similarly, they experienced the maximum mindfulness, resilience, and vitality. All 6 psychological parameters demonstrated significant improvement months after the Samyama program compared to the. Continuing with the results, at all time points, household controls had 2 to 3-fold higher CRP levels than participants. At time point 2, participants had higher HDL level and lower HbA1c levels. Participants had lower triglyceride levels at time point 3 compared to time points 1 and 2. Now to conclude our presentation, psychological parameters were significantly improved with participation in the Samyama program. Preparation for Samyama had benefits on its own, including a reduction in anxiety and depression. Additional health benefits were also seen in participants, including improvements in HbA1c levels and lipid profiles. Future studies are needed to evaluate the longer-term sustained benefits of the Samyama program.
Yeah?
We thank you for listening to our presentation and hope
चल
you.
रहा है क्या क्या चल रहा है हाँ?
Now, our next presenter is Ms. Shri Raksha Bhide from NIMHANS, who will be talking about the study Awareness about Yoga-Based Counseling Among Patients with Common Mental Health Disorders, Patient Perspective and Expectation.
Greetings, everybody. My name is Shri Raksha Bhide. I'm a PhD scholar from the Department of Psychiatry in NIMHANS, Bangalore. My poster for today is on awareness about yoga-based counseling among patients with common mental health disorders, patient perspective and expectation. Although research into yoga looks at components of asana, pranayama, and meditation, the psychotherapeutic potential of yoga philosophy has not been explored. With the rising gap between mental health care providers and patients, and studies depicting the inability of Indian population to completely adapt to Western counseling, there is a need for an individualized, culturally sensitive counseling module which was explored in the study. A sample of 18 patients diagnosed with CMD of CGI less than 4 of A, those exposed to yoga practice, and B, not exposed to yoga practice were included. Data collected was audio recorded, transcribed for emerging themes using the inductive method of thematic. The contents of the semi-structured interview developed included patients' awareness about current models of Western counseling, yogic philosophy, and perceived benefits, the need, usual negative thoughts, and willingness to participate in such a program, and the expectation from a yoga-based counseling program. Over half of the patients reported thoughts that mainly needed addressing in the program included, why is this happening to me and how do I handle this situation? The interview results depicted that over 89% of patients considered this intervention as harmless and were willing to participate. None were aware of yogic counseling, with over 55% of patients equating yoga to physical exercise. There was a unanimous agreement on the need to start this program. 48% of the patients preferred 1 to 2 sessions to be conducted per week, while 61% expected the counselor to give advice, listen, and understand them. One patient undergoing yoga practice stated that yoga counseling before practice would help him keep his mind more focused during the practice. In conclusion, this study gave us an insight into the cultural expectation of a prescriptive counseling among the Indian population, expected qualities from a counselor, and the needs that have to be addressed. This understanding could help bridge the gap of yoga seen as a physical exercise to a holistic model addressing the deeper mental and emotional needs of patients with CMD. Future research could aim at development and feasibility testing of a yoga-based counseling program in a clinical setting.
So this will be our penultimate presentation of poster today by Aditi Devi N from NIMHANS, who will be talking about yoga as a monotherapy for severe depression.
Namaste, I'm Aditi and I'm here to present my poster titled Yoga as a Monotherapy for Severe Depression. Depression is a common mental disorder with potentially serious consequences. The three cardinal symptoms include low mood, anhedonia, and easy fatigability. Depression could be mild, moderate, or severe, and also it could be exogenous or endogenous depending on the presence or absence of a trigger. Yoga has found its space as an adjuvant therapy for depression, and its potential as monotherapy is now being explored with a sizable measure of success. However, yoga as monotherapy has been limited to mild or moderate depression, which more often than not falls into the exogenous category, thus limiting its scope of efficacy. Hence, the aim of the study is to explore yoga as a monotherapy for severe depression. Presenting a case report of a 31-year-old lady with second episode of depression with no identifiable trigger. She was found to have severe depression and was offered antidepressants as per protocol, which she firmly denied and chose yoga as the only intervention. She underwent 10 supervised sessions with a validated yoga module over a period of 2 weeks. The psychiatrist monitored her closely over various assessments, which included the Hamilton Depression Rating Scale, Anxiety Rating Scale, visual. The yoga module had an optimum balance of dynamic practices like Surya Namaskara, Kapalbhati, and Bastrika, and relaxing practices like QRT, DRT, and Ujjayi, interspersed between other asanas focusing on the backward bend poses. Coming to the results, the patient was able to learn and practice yoga, and it was reflected in the YPA scale. The HDRS scores dropped drastically over 2 weeks. The moderate levels of anxiety also faded with the therapy, and the improvements also reflected on the VAS and PSS. To conclude, exogenous depression almost always has a known external trigger, and the solution lies in the same. Unlike endogenous type, which is more likely to be caused by the dysregulation of the physiological processes as mentioned here. Coincidentally, these are the very processes that are positively affected by the practice of yoga, as demonstrated by a multitude of studies. Although yoga has been recommended mostly for mild to moderate depression, recent studies shows its efficacy in more severe forms and also in suicidality, prompting us to explore its efficacy in the unexplored areas, albeit with precautions. This ensures that no patient seeking help for depression, irrespective of severity, is denied the choice of yoga in a medical setup, and yoga could emerge as an effective, almost side effect free, patient initiated therapy and a prophylactic habit for life. Thank you.
Now we come to the end of today's poster presentation session. Our last speaker for today is Dr. Abhijit Datta from National Institute of Homeopathy, Kolkata. He'll be talking about Yoga for Mental Health Outcomes Among Healthcare Workers, a systematic review.
Hi, I'm Dr. Abhijit Datta. I'm a postgraduate trainee at National Institute of Homeopathy, Kolkata. We performed a systematic review on the effect of yoga in various mental health outcomes among healthcare workers. And I would like to share some thoughts and results with you. And I have no conflict of interest in relation to this study. It is an undeniable fact that healthcare workers are prone to suffer from various mental health troubles like depression, anxiety, insomnia, stress, etc. Yoga could be a better option to cope from this situation, but the proper evidence have not been reviewed so far. With this intention, we aim to conduct this systematic review so that we can create an evidence base which can help in decision-making process. For the said purpose, we searched mainly in 4 electronic databases with a predefined search strategy. Along with that, we also carried out hand searches to find potentially relevant studies. We only included randomized controlled trials which purely concerned with yoga intervention. We have not included those studies which used multimodal interventions or complex interventions along with yoga. Risk of bias of every study was assessed by 2 independent reviewers according to Cochrane risk of bias tool for randomized trials. The study was conducted in adherence to the PRISMA guideline, and protocol of this review was registered prospectively at Prospero. At the initial search, we obtained 574 studies. After removing duplicates, screening title and abstract, followed by full text screening, finally 7 studies were included which fulfilled the predefined eligibility criteria. Most of the studies were on nursing population. 3 studies used waitlist as a control. All the studies evaluated stress, and few studies additionally measured other mental health outcomes. Almost all the studies reported improvement in various mental health parameters. But 2 of them reported or used clearly defined intervention plan. Only 1 study qualified for low risk of bias, while others have some concern to high risk of bias. We couldn't perform quantitative synthesis or meta-analysis due to the presence of significant amount of clinical and statistical heterogeneity in between the studies. A very small number of studies cannot be utilized to come out to any firm conclusion. However, available evidence cannot preclude the possibility of some beneficial effect of yoga in mental stress among nurses. Studies are very much lacking in other mental health outcomes with an uncertainty of data. Better studies should be designed with validated yoga module and enhanced methodological rigor for the problem areas like stress, insomnia, depression, etc. in the defined population.
That's for the poster presentations today. I would like to stop sharing my screen now. Meanwhile, I would introduce Dr. Umesh, who's the scientist in in Ayurveda in the Department of. Before moving ahead with Dr. Umesh and handing the responsibility over to him, I would like to thank Dr. Mariamma, Dr. Gurudev, and Dr. Ramajayam for being there, for judging our posters. And we again will meet you tomorrow for the last session of the poster presentation. Thank you very much, ma'am. Thank you very much, sir. Thank you, sir.
Dr. Sanchari,
Yes, sir.
we will show our NICY video.
Sure, sir.
And then Dr. Umesh will take over.
Sure, sir. Okay. Sir, now I'll hand it over after this NICY video. We'll hand the responsibility over to Dr. Umesh. Thank you.
The word yoga has its origins from the word yuj, which means unite. "6,000 years ago, yoga originated as a spiritual lifestyle in our country. Yoga is a means to unite the body and mind, thought and action, and to create internal harmony. In the spiritual sense, it unites the personal consciousness with the cosmic one. Today, most people see yoga as a set of postures and a few breathing practices, while some others consider yoga as a form of meditation. 9th century BC, sage Patanjali laid systematic foundation of classical yoga. In his Yoga Sutras, Patanjali emphasized on advanced meditative techniques. Later on, Hatha Yoga evolved as a preparatory step for classical yoga of Patanjali. Hatha Yoga mainly focused on physical postures and breathing techniques. Another important yoga text, Bhagavad Gita, defined yoga as a state of equanimity of mind in success and failure. The National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru, has been a pioneer institute for psychiatric and neurological services in India. Research in yoga has been going on in NIMHANS since the early 1970s in the Department of Neurophysiology and Clinical Psychology. In 1990s, the work was continued by the Department of Psychiatry in collaboration with Art of Living Foundation. Considering the popularity of yoga, it was thought essential to establish a yoga clinic and research center in specialized fields of medicine. Yoga services as the therapeutic intervention in the hospital began with the setting up of the Advanced Center for Yoga in Mental Health and Neurosciences in 2007. The Morarji Desai National Institute of Yoga, MDNIY, New Delhi, supported and collaborated in this endeavor. NIMHANS later integrated the center as a part of the institute itself as the NIMHANS Integrated Center for Yoga, which was established in 2014. NIMHANS is the only institute to have a dedicated yoga center for mental health and neurosciences. On December 1st, 2016, yoga was listed by UNESCO as an intangible cultural heritage. In the field of medical science, several studies indicate the physical benefits of yoga. Recent researchers have demonstrated yoga to be a powerful means to reduce depression and anxiety. Regular practice of yoga causes a reduction in the stress hormone cortisol, increase in the cuddle hormone oxytocin. A neuroimaging study on healthy persons showed that Chanting Om reduced brain activation in areas related to emotional control, suggesting that it has a potential to calm emotional disturbances. Scientists have studied the effect of yoga on nervous system as well, and have observed that there is a structural, functional and chemical change in the brain of people who practice yoga regularly. Through this practice, the functioning of the brain becomes better, the autonomic system stabilizes with increase of parasympathetic system functioning. This in turn has effects on other organs as well. As a consequence, yoga practitioners experience a high degree of psychological well-being and demonstrate increased competence in their skills. Yoga is known to increase markers of brain plasticity such as brain-derived neurotrophic factor (BDNF). It helps prevent degeneration of brain cells or even an increase of brain volumes in areas of memory, hippocampus, especially in the elderly. Depression is the most common psychiatric disorder. Initial work was done to look at the effect of yoga on depression. It was found to be effective in reducing the symptoms of depression, almost equivalent to antidepressant medications and ECT. It has been found to be effective in anxiety disorders also. Further advancement in yoga-related work was done in collaboration with the S. Vyasa University from 2000 onwards. Schizophrenia is one of the severe mental disorders. Despite significant advances in pharmacotherapy, treatment remains suboptimal, with many patients having persistent deficits. Despite several challenges in adapting yoga in clinical practices, the NIMHANS Integrated Center for Yoga has made several efforts in this direction, wherein psychiatrists and neuroscientists have collaborated with yoga experts from S. Vyasa and MD-NIY, Government of India. This has led to the development and validation of specific yoga modules for disorders such as depression, cognitive impairment in elderly, and schizophrenia. Mr. Dhirendra Brahmachari came up with the idea of having advanced centers of yoga in medical institutions. They chose NIMHANS, JIPMER and DIPAS. The idea was to collaborate with well-known medical institutions to conduct research on yoga as a therapy. As part of this research, NIMHANS got a grant for 5 years from MD-NIY, and this research project was completed in 2012. In 2013, a whole supplement of Indian Journal of Psychiatry was published exclusively on articles on this research. Swami Ananda Yoga Anusandhana Samsthana, S. Vyasa, is a UGC recognized deemed university working for making yoga as a socially relevant science based